Happy Sunday to everyone watching. It's good to see you all. Today we'll be looking at our mental health section. While we're waiting for our guests, I mentioned earlier some of the areas we'll be looking at, and this awareness section, what is all about. The National Minority Mental Health Awareness Month is observed each July, and that is why we're celebrating and we are marking this minority mental health section, and that is why we've added it to our talk section today. And the second thing we'll be doing on this show today is we'll be celebrating with NHS on Wednesday, that was the 5th of July. NHS here in UK, the National Health Service Clock 75. So as part of the vision on this platform, we celebrate people as well. We celebrate communities. We celebrate, part of the vision is celebrating. So we will celebrate today a special shout out to NHS at 75 to 75 years of making a difference in the life of many people in the United Kingdom. So it's a privilege to partner and to be part of NHS and also to celebrate NHS. So the need for this year NMMH, which is the National Minority Mental Health Awareness Month, is to promote educational efforts on the health problems currently facing minorities and other health disparity population. So we'll be looking at those three areas I mentioned earlier. Our guests will be looking at that in a minute, and we'll come back to celebrate and to do this special shout out for NHS at 75. So happy viewing and thank you for joining. Good afternoon.
Good afternoon. Thank you so much for having me today. Relin Crown. It's always a pleasure to hear from you and to honor your invitation. Thank you so much.
Thank you so much.
Congratulations to every NHS staff. Oh, there's feedback. I don't know why. Every NHS staff, every NHS user, because apart from the staff, also the users have been of what's the word, of importance, great importance, to the NHS. So congratulations to us all. And yes, indeed, we'll be talking about the importance of the mental health of the minority. So I've got some pointers here, so I might be looking down a bit. It's just to look at my card as I go on. So
before you start, Mrs. Olubukola, again, you're welcome and thank you for the privilege, for honoring the invitation. I know it was a short notice, and of course, we need to celebrate you as well. So thank you so much. And before we start the talk for today, I'm going to be reading a short citation about our guests. I want our audience to know who is talking to them out there. So on this platform here, we have with me on the live studio our guest speaker, so which Mrs. Olubukola Akimolayo Gudele. She is a registered nurse, over 10 years experience in nursing and work as an HOPA GI clinical nurse specialist. Ms. Olubukola is the founder of Overseas Nursing Solution and co-founder of Nigerian Nurses in UK Group. Bless her. She is also an entrepreneur and a vlogger on YouTube, Olubukola TV. She has the passion supporting overseas nurses that have just moved into the UK to settle well in the system. Thank you for doing that, sis. God bless you. She loves coaching and enjoys public speaking. As a modern nurse, her goal is to make positive difference, also to impact our generation positively. Above all, Mrs. Olubukola is happily married with kids, a mother of 2 and a Christian. So you're welcome again, Mrs. Olubukola, with me here on the live studio. Thank you so much for joining us again as we allow you to take our talk for today's topic. You're welcome.
Thank you for that introduction, and thank you for having me. So like I said, I've got some of my cards, some of my jottings here. So at some point I might be looking sideways. It's just to pick my point up. So just moving on, we are celebrating the National Minority Mental Health Awareness Month. And like some of you, if you like to check things on Google, you find the month is being celebrated in the US. This theme is being celebrated in the US this month. However, the UK also have something like that, which is what we celebrate in April every year. And we cannot take away the fact that, yes, indeed, at every stage of our lives, we all feel like we've hit the rock bottom or we've hit the plateau with regard to our mental health. However, it's as though it hits more, it hits differently when you are from the black and minority ethnic group. The struggle is real, but then it is uniquely real, for those of us in the those people they categorize as the ethnic minority, community. So, as an introduction, I would like to say first that I will be talking as practically as possible. Yes, I know we have studies. Yes, I know we have findings. Yes, I know we have scientific backups that we'll be mentioning as we get along. But as much as possible, I will liken every point to our day-to-day scenario. That way it's not far-fetched. We can, bring this to context and not think, oh, maybe they're not talking about me. Maybe it doesn't apply to me. Because really, in the real sense of it, it applies to everyone, like I said, at one point or the other. So mental health includes our emotional, our psychological, as well as our social well-being. And it is very important to acknowledge and to explore the issues concerning mental health, because there is absolutely no way that you know that you're struggling with your mental health if you do not identify it, like I said earlier. And it's just like being sick we say headache, or being sick with running temperature, or being sick with abdominal pain, or being sick with leg pain, or whatever it is. You've got to accept at first that yes, there is a problem. And before you can know that you've got a head pain or headache, you actually would know what your normal head feels like before you can then understand that yes, this feeling is different, so this feeling is abnormal. So which is why it is important, as we from the minority ethnic group, it is very important for us to always check ourselves. What is our norm? What makes me feel happy on a good day? How do I relate with people on a good day? How do I relax on a good day? Now, what is different now? Am I now more touchy? Am I now more what's the word? I want to be on my own. I want to keep to myself. I don't want to reach out. When people reach out to me, I don't want to accept it. Those are abnormals, from our normal way. And the reason it is important is because study has actually shown that racial minority groups across the US, as an example, just like it is in the UK, they have, I mean, God forbid that portion, but then studies have shown that we have higher levels of anxiety, we have higher levels of depression, higher levels of suicidal tendencies, higher level of post-traumatic stress disorder, and other mental health, disorders, if we can just name it. And when you want to think about it, like, how is that? How come it is that way? When you think about it in the real context, oftentimes we are immigrants. So apart from the pressure that comes from, okay, I've got to meet up with my bills, I've got to make sure the wife and children are happy, I've got to make sure we've got planned holidays, you then have to consider the people back home. Now, this is me, like I said at the beginning, I'll be making it as practical as possible. That way it's not too far-fetched. And even sometimes when we feel as though we've been in the country for so long, we probably got our stay, we are all fine, but we cannot take away the fact that we've still got families back home, whether they are here now. Some of them even still call us even though they are here now. So the kind of things we think about is more than the kind of things an average person who was born and bred in the UK, as an example, thinks about. Like something a friend of mine we're both talking about. We're saying, how come come weekend, we feel as though we are not even rested? The weekend is not enough for us. Yes, an average white person would say, oh, I don't feel rested as well. Weekends are made in China. But yours is different because there are other commitments. Many of us will go to choir practice. Many of us will go to church on Sunday. Many of us would have meetings after church on Sunday. Then we'll still come home to do other things. And the list just goes on. Whereas the other category of people that we live together in the UK may not even go to church. This is me assuming. And other factors like that could cause more stress for us. I was doing a presentation about stress. It was a women gathering, and we're talking about the effect of stress on women or on Black people generally. And we realize that oftentimes in a group of, say, women, men and women, we talk about sexual issues, we talk about hypertension, we talk about endometriosis, we talk about big words. But we actually somehow let things like stress seep through the net. You know, we don't talk about it as much. And when I was preparing for that presentation, and I was going through study actually has it that we Black and minority ethnic groups are found in the most stressed, you know, categories of people because of so many factors, you know, which is why, like I said at the beginning, this is important to pay attention to it. And moving on to the point that we have this morning, not morning, this evening, I want to talk about our men. So before I do that, the first point says the importance of improving the health of racial and ethnic minority communities and reducing health disparities. So with regards to that, before I can talk about the importance of improving it, who are the people that are mostly affected by these problems we're talking about, especially mental health? The first category of people are men. So a Black man, according to study has it that according to the mentalhealth.org, you know, website, Black men are more likely to experience psychotic disorder in the last year than white men, and also Black people in general are 4 times more likely to be detained under the Mental Health Act than white people because of these very many factors that we've talked about and we have not even, you know, talked about. Now, why is it very important to make sure that we improve the health of racial and ethnic minority communities? Number one reason is because we ourselves often neglect, you know, the important things. And it's just like our normal health, our physical health. Talking about how sometimes we don't go for checkups as we normally should. When you have that back pain, you've got that painful urination, and you'd ideally, well, a white man would ideally go ring the GP for help. We would just want to monitor it for like 2 weeks more, you know, and there is no way we can improve our health, whether physically or mentally, if we don't pay attention. So which leads to the first point. The importance of it is just so we can improve, you know, with our health. Also, we can, you know, be a less problematic generation. And when these studies are continually being conducted, these numbers can drop a bit, which is one of the importance. And also, just so, you know, we can come the nearest future, we can make sure that we pass down the good vibes, the good news about Blacks, you know, than we have at the moment, the number, the statistics that we have right now. And how can we do that? You know, the first one is I've talked about identifying problems and making sure that once we identify them, we go for help. The second one is, when I was preparing for this, we said one of the most, or some of the most common problems we face is our immigration status, which was why I talked about we being immigrants at the first instance. Then our economic situation. You find that most of the odd jobs, you know, would find the minority ethnic groups in most of the odd jobs you can think of. They're not the best paid, but then we are just the most, you know, in all of these jobs. They are stressful physically, they are stressful mentally, they are stressful in every way you can think of. And also our educational, you know, level needs to be worked upon as well. We need to push ourselves to read more, you know, because there is absolutely no way we can improve if we don't work on the background problems, which is the educational level, like I've just said. Then access to high positions. Some people just don't have interest in high positions, while some people have interest, but then there is no access to it. So the community at large opening more access for us, you know, to go, because by that way, if I have that sense of fulfillment that I've read, I've studied, I've prepared for that job, and I got the job, I've not been discriminated against, and so on and so forth, I would feel relaxed. I'll feel fulfilled in myself that at least I've achieved that one thing, you know. And of course, job availability, access to public health funds, and the likes. So if we then move on quickly, so how can we reduce these health disparities? Right, one thing is tucked into the other. There is no way to reduce these health disparities if we don't identify what the problems are, which was why I've gone through all of these things I've just gone through. The second point is the unique struggles that racial and ethnic minority, you know, communities face regularly with regards to mental health. And they are the ones I've mentioned, which is why I've said they're actually talked into one another. So the problems we face is access to job, you know, the kind of jobs we have access to. They're the low jobs. We call them the low hanging jobs. more of the low-hanging jobs. We don't want that anymore. We also should put ourselves forward to study, even if there are short courses that we need to do. Now, there are some things that are a bit, I don't know if it's tribalistic, that is the word I'm looking for. What I'm trying to explain now is there are things that we've carried on from generation to generation and then moved into this generation, and we are ready to even pass it down. Which one of them, as a clear example, is men are not allowed to cry, which is why when you're talking about studies, statistics, scientific, studies and findings, you find that our Black men struggle the most when it comes to mental illness. And that is because they are not, by culture, okay, I think culture is the word I'm looking for. By culture, they are not allowed to cry. A Black man should swallow it all up. And I'm assuming it might be the same with other, minority ethnic group. The cultural problems are the things that we need to also, work on. That way we can improve. Because we cannot talk about improvements, like I said earlier, if we don't talk about the problems or how we are getting to those problems in the first place. So moving on quickly to how can we then address inequality of access to services and then promote mental well-being of the minority. I believe the very first way to address inequality of access to services is if we speak up more. Now we have to speak up. Apart from speaking up, if you feel as though there is something you want to access, whether it's access to your GP, access to a particular referral system, and you're being denied of it, you should speak up. It is high time we stopped, just waving everything behind our back. They haven't let me. That is how it has always been before the days of our forefathers. That is how it will continually be. So we need to speak up. We need to be very bold, and say, this is not right. I need access to it. Is there a reason I'm being denied it? One of it that I would like to highlight is, I don't know if I remember when I was in uni, we're talking about a few midwives, rather, we're talking about how Black women often die postpartum or whilst in labor, that the rate is higher. The rate of pregnant Black women in comparison to the whites, whether prepartum, intrapartum or postpartum, is higher. And that's because, for instance, we Blacks, our pain threshold is higher. Well, I believe it is higher. We often hold everything. We contain everything. Before we complain about that sciatica pain, before we complain about that muscle tear, before we complain about everything, we would have tried every natural option that is possible. Oftentimes they work for us. Oftentimes it is important to mix them with scientifically proven conventional medicine. We can add it with ours and just find a balance, as against using ours only. Or even if it's just for documentation only, is the reason you are saying it to your GP that I'm struggling, then it would actually form a baseline when they push you into the theater or they push you into the delivery room, and then they notice that you're struggling to push the baby out. They can see it in the record that you've mentioned it at some point, that you were struggling with so. And that way they can trace it back and help you. As against swallowing everything, I won't let them know because I don't want to be diagnosed. I don't want to be labeled. I don't need their treatment. I've got my natural method. And then it causes an increase in the death of Black mothers than they would find with white mothers. So back to the point before I digress too much, how can we address this inequality of access to services? First one for ourselves is to speak up. Second one is, like we said earlier, we need to educate ourselves more. Now, you cannot know that there is a problem, like I said earlier, if you do not know what the norm is. You cannot, if you don't know that you've got access to some kind of funds, or you've got access to council house as an immigrant or something, or whatever it is. Of course, immigrants are not allowed, especially those on tier 2 or some restricted kind of visas, But the point I'm trying to make at the end of the day is, if you don't know what you've got access to, there is every chance that you miss out. An example in that regard would be maternity pay. Many of the people that come in as nurses, healthcare assistants, when they come in, they get told so many things. They are struggling financially. Of course, it leads to their mental well-being. Their husband is struggling, they're the only one working, and then you're at home, you're taking care of baby. There is no pay because you've come in from Nigeria pregnant or your country pregnant, and you do not know that you can actually get SMP because you've worked a bit and you've contributed national insurance. So you can get something from the government, no matter how little. Now you're struggling physically, financially. It will then lead to a mental struggle because of lack of information. So part of the ways to address it would be us educating ourselves, knowing what we have access to, what we don't have access to, what we are liable to, what we mustn't touch, and things like that. And also, when we educate ourselves appropriately and put ourselves in positions of power, quote and unquote, it means that we can also speak up and represent our people, to say that before I got to this position of power, these are our struggles, or these are the pain that my people are facing. Now, how can we bring up rules and regulations and policies that ensures that, irrespective of how, you're still using the example of a Black woman who doesn't complain about her pain or some struggle she's having in pregnancy, how to make sure that even when she doesn't complain, how can we make sure that she's still being supported when our struggles or our undocumented problems then result in a more complicated issue, things like that. So education then leads to policy. And of course, the other thing I was going to mention is the cultural part of things, addressing inequality of access to services. We also need to work on the cultural aspect of things, know how to find balance. And also, the other part of the question is, how do we promote mental well-being of the minority? So I believe one of the ways to promote it, like I say to people, especially because I am an immigrant, like a good number of people are, is you need to have an ally, a group of people. They may be your church ally, they may be your work ally. You don't have to necessarily be their friends, but then a group of people that you can speak to when you have issues. And then even though they don't know, they can ask people that know for you and say, okay, do you want to check this service up? They support mental health, or they support people that are struggling with finances. Because no matter what, the way the system, the human system works is that the physical, emotional, mental, psychological, social, and every other part that you can think of, they are actually interlinked, they are interfaced, they are intertwined. The point where once you are down financially, sometimes, even if you are normally jovial, you just sink, like you literally sink into becoming, God forbid, depressed, when you don't even know it or you're not realizing it, simply because you are financially troubled. Or maybe a physical issue can lead to a mental problem. And some things are actually hereditary, no matter how much we say, God forbid, God forbid. Some things are hereditary. If you've noticed the trend in your family, which is why I've said it's important to pay attention to ourselves in addressing this inequality. I've checked the trend, according to genetics, this is what happens in our family, just like cancer sometimes and so on. You then speak to your GP, which is why I said spoken words cannot be overemphasized. You speak to your GP as an example. Okay, these are the problems. Is there a way I can be supported before I go down the same line as my grandmother or my grandfather and so on? So I've talked about allyship. I've talked about, assessing our trend as our family trend, and also asking questions from your GP, from your ally, what is available to you. Speaking up is very, very important as well when it comes to promoting mental health. And also another thing is knowing when you're beginning to go down the drain and speaking up, which of course goes back to speaking up. We need to speak up. When you know what is available to you with regards help, you can always access it because you've decided to speak up. I believe there are still 1,001 other ways to promote mental health and mental well-being. One of the things when I was talking about problems was how, as immigrants, we have so many things bothering us. I say to people these days, if you've got no help, you probably work 5 times a day. The kind of things somebody who walks 3 times a day will be able to do. you may not be able to do it. And comparison is the thief of joy. So we have to be intentional about making ourselves happy. Now, if you keep comparing your lifestyle, so which is another point which we don't talk about often, but it's very important, assess your family dynamics, assess your individual dynamic, and stop comparing it with any other person's, because we are all unique. Our dynamics are so unique in such a way that if you keep comparing yourself, you either stay depressed, God forbid, or you either just run and run till the life is no more. There was a story we heard in one of the videos, going around some months ago, about a lady who, she had so much projects back home to do, and she was trying to hit the target. Of course, we all have targets, we have aims, aspirations, dreams, and so on. But then if she could work 8 days in a week, she would do it. And she just kept going and kept going. I must finish that project by November. God forbid she died midway. I think the story was a month ago. She died in June, I think early June. And the project has gone nowhere. Like, the project is now halfway done. Our children are now motherless, and she's got no husband. She's a single parent. So we need to know when to stop. We need to know when to pause. Even if you don't want to stop, just pause and think, can this be left? Let's just set realistic goals for ourselves. Can this be paused? Can this be stopped? Can I delegate this task to somebody else? Can I make this goal, no matter how important it is to me, can I make it a medium-term goal as against short-term goal? If short-term goal would make me run till I forget that I'm not resting, and God forbid I slump and die. Questions like that are things we need to continue to ask ourselves. And of course, I pray the Lord continue to touch the government. The government also needs to pay attention to us as minority and minority ethnic society. And that way, if they do so, I believe it would help us at large. I can keep going, but because of our time, I'll just stop there. I don't know if there's any part I've missed out.
Thank you so much. In fact, you've touched some of the areas I would like to touch again on this topic, in regards to this topic. Because we don't have much time, I'm going to quickly, thank you so much for that section. I'm going to quickly ask just a question before you leave. And if you're out there watching us live, you want to ask my guest a question before she leaves, you can drop that on the comment section. I will read that so I hear him. So I want to ask you a question, please. We're looking at mental health as a talk today, and if you agree with me that stress can also lead to mental health, and there are a lot of things we can see that is going on out there, especially people that take a lot of shifts, overwork and what have you. So if you understand if we look at the higher increase of the cost of living here in UK at the moment is so high, and everyone wants to work and get more money to because of bills and other things they need to do and look after the family. So what advice can you give to the Black minority, especially people living in UK, in terms of managing their mental health? And of course, you said more about it. If you can just advise some of our sisters and brothers out there in the UK, especially for the Black minority. Thank you.
Thank you so much. That's a very good question, especially because, like I said at the beginning, it's just good to be more practical. We can keep going according to, and keep quoting all the scientific thing, but we need to bring it home and just be as practical as possible. Now, answering the question, what I would say is cut down, assess, write down. That word assess, I use it a lot because there is absolutely no way to reach a solution if you don't first assess, identify, and accept that you're struggling. Write down, do an assessment of what your total income, be very practical about this, what your total income is and what your total expenditure is. When spaghetti was still 12p, I could buy 10 or a whole box. Now spaghetti is 25p. Does that mean buying half? What are some expenditures that are not needed? I did a video on my YouTube channel. It must have been 2 or 3 years ago. Not even knowing that I would reach this inflation rate that we are in at the moment in the UK. I was talking about how I pay for gym subscription and I hardly go to the gym. Cancel subscriptions that you don't use. Cut down your expenditure so much, especially if your income remains the same in this so inflated economy that we are in at the moment. Cut down expenditures, avoid them, suspend some things. Because what I believe in, like we all do, is it is because we have breath in our nostrils that we are able to promise somebody 200k every month. If that 200k every month you send home, or whatever it is that you do for somebody, is beginning to impact so much and means you'll be so stressed, you can just reduce it and explain to them. Or if you want to continue doing it, you can probably find a way to increase your income. And what I say is there are two ways to it. You can cut down expenditure, but if you have cut it so much to the point where I can no longer cut it, I've removed excesses, I've removed things that are not really worth it, not worth it, but things that I can avoid for now, but then it's still not matching up. Think of how you can then increase your income without having to stress yourself. That will be the next stage. Actually, it should be the first stage. Increasing income should be the first stage. Now, how can you increase your income without so much stress? There are so many ways these days. People talk about e-commerce, people talk about Shopify, people talk about importing and exporting. You can do it from the comfort of your room without picking up extra and extra and extra. Imagine you work in a care home where there are at least 3 residents, and in one night shift you have at least 35 of them, and you want to do it for 7 days, and it is just that one you. How about you maintain your 3 or 4 nights that you normally do, and the remaining 3 days, apart from catering for your family, you find something that you can do on the side hustles. Is it a value that you put out that gives you money? Like YouTube is a passive income. A video I did 3 years ago is still giving me money now. Even though I've done it 3 years ago, I can't remember what I looked like when I did it. Find ways to make money that would not so much stress you, especially physically. With mental stress, say, I feel stressed, I've done so much calculation. When you rest for 2 hours and use medication, you calm down. But physical stress plus mental stress, you are doing back in the hospital or in the care home or in the factory, that way. You are going to, is natural. We would wear out with time. And your mental health also is also being disturbed. So side hustles to increase income, anything it is you feel comfortable with. Some people don't like marketing, no matter what you do. Whatever it is you want to do, real estate, property, rent to rent, buy, rent, refurbish, and remortgage. There are so many schemes with regards real estate. You can do that. You can do Airbnb. You can see what the Crown is doing. It's something as well. You're impacting people, but then you can get promotion for it, where people ask you to promote their products, and you're sat in the comfort of your room and you're getting something for it. As an example, I pray God takes you to greater heights, madam. These are ways that some people make money just in the comfort of their home. On and on and on that way. Increase your income or cut down your expenditure or do both. And I pray God will continue to help us all.
Amen. Thank you so much, sis, for joining us today. God bless you. And I will see you again on this platform. Thank you so much. And regards to the family.
Thank you so much. Thank you.
You're welcome. Thank you so much. Bye. So thank you so much for those that join us in the course of today's section. We've looked at a topic which is the better health through better understanding, being the mental health talk section we had today to mark the National Minority Mental Health Awareness Month. Actually, this is marked in US for this month, but here in UK, because we're celebrating NHS, that's why we decided to bring up this topic. We had that in April, so we'll bring all this topic. So we've all heard from our guests today. If you're just joining, you can watch that from the beginning of the show. So I'll be looking at some of the points we've look at in the areas we've mentioned, the importance of improving the health of the racial and ethnic minority communities, reducing the health disparities. So some of the points I would like to look at in the short, in summary, is she has said most of the things I want to say, but few things I would like to add is the importance of improving the health of the racial and ethnic minority. The first thing is to build awareness about the disproportionate burden of the nature of where we are in UK, especially for the Black minority, and of course, illness and people from racial and ethnic minority group. There's stigma, of course, there's stigma out there, but we need to understand how to build this awareness as well to let others know, and also to encourage action through health education. education is so paramount and so important, and early detection and control of disease complication. A lot of us are passing through stress, we are passing through sort of mental issue cases, but we tend to hide it because we are used to it. If I look at the origin of Africa, a lot of us shy away from our mental health. We don't want to discuss our mental health. It's been ages in Africa that a lot of people doesn't want to discuss it. It's an issue that we need to debate on. So it's also to encourage this action through health education, early detection, as I mentioned. So it's also paramount that you speak out, just our guests have said. You speak out when you're passing through challenges or any mental health issue. No, it's not a problem to have a mental health issue. There are lots of people out there that they are undergoing through depression and they take medication for that. And of course, there are lots of people undergoing so many things related to mental health. So don't be shy away to discuss, to speak out, even whether to speak to your doctor or to speak to those people that can support you or where you can literally get help. So we've also looked at the second point, the unique struggles that racial, ethnic, minority communities face regarding mental illness. Now, some of the points I would like to be sharing with us is inability to recognize that mental health. A lot of us shy away from it, as I mentioned. Accepting mental health is a problem. So speaking out is a first solution, is the first thing we need to understand that is a problem, but we need to speak out, saying all this. Of course, positive impact of social network can help as well. There are a lot of things out there. My guest mentioned it that using Africa as an example, when we have one thing or noticing something, we always use self-care. As a person in Africa, that is one of the things we normally do because before we can, seek the help of doctor. So social network as well gets involved as well, gets, help where you need to get help. There are a lot of organizations that do help in terms of mental health. There are a lot of organizations here in UK if you're struggling with mental health. And reluctance to discuss psychological distress. So you need to get help. There are a lot of help, as I mentioned, in the UK here. There are loads of help we can get to deal with our mental health. And the cultural identity. In fact, there are churches, there are communities that can help when we talk about mental health. You can consider counseling as well as going for, to see your doctor for medication and stuff like that. And negative perception of social stigma. A lot of us think because there is stigma out there, we don't want to share, we don't want to talk about our mental case or mental issue. Is very, very essential that we, speak out and talk about this mental health, regardless of the stigma around us. And other thing I'll be looking at, which is the last point, the barriers to address inequality. So this can be affecting factors. We look at some of the affected factors in regards to barriers to address inequalities accessing service as a Black minority. So the first thing is the impact of long waiting times for clinical assessments. So come to think of it as a Black minority or someone that lives here in the UK, we think because there is a long process to get a clinical assessment or to get an appointment with a doctor. So because of that, we just manage our health. Sometimes we need to speak out. We need to do what is we are expected to do to get help, regardless of the long waiting times. We all understand here in UK that it is a process within the NHS to get an appointment within the NHS if you're, be it hospital appointment or with the GP. So let's look at that as well by talking about the clinical assessments. Is a long wait, but we need to bear in mind that if you need help, get help when you need help. And I mentioned that this can also be a big factor affecting a relationship between the service user and health providers. We think because of this long wait or because we can't get appointments, we believe it's racism is this and that, as we used to say, as a Black minority. So let's come to think of it that we need to address this issue as well within the service user and out of the health providers. And other points we're looking at in terms of the barriers to address inequality to access service here as a Black minority. Sometimes we have a language barrier issue, and there are a lot of people that don't understand your accents. So if you need help for translator, you can get help. If you have something that you're dealing with in terms of mental health that can affect your mental health to be derailed, then you can get someone that can speak better than you, as well in terms of language barriers, because communication is also vital when you need to communicate and speak out. Also look at the barriers to address inequality in assessing service could be poor communication between service user and health providers, as I mentioned. This can also be a factor that can affect Black minorities. And also inadequate recognition or a response to mental health needs. A lot of us pass through one mental health area or the other. I think it differs. Some people are dealing with depression, while some people are dealing with PSTD. So there are a lot of mental health areas that people deal with. So you need to recognize this and how you can deal with it in terms of the support you can get either within the community or with the health service as well. So imbalance of power and the authority to service users and provider, it's also important that we speak out when we're facing as a Black minority facing mental health. Discrimination towards the needs of Black minority service user and lack of awareness of different services. This is speaking to the government. Sometimes a lot of people doesn't understand that there tends to be a lot of awareness, such like the one we're doing out here now to mark to mark the minority mental health month awareness year right now to talk about the issue. So let's be aware that there are a lot of awareness, there are a lot of support out there that you can get in regards of the discrimination or the limits towards the Black minority. And also the mental health, as I mentioned earlier, is a condition that do not discriminate based on the gender or rule, color or whatever, or gender or identity. So anyone can experience a mental health or mental health challenges, illness, regardless of their background. Anyone, it can